Hello, I'm Dr. Janice Nevin, President and CEO of Christiana Care. With winter fast approaching, we continue to see increasing numbers of COVID-19 cases throughout the United States and here in our own community. The virus spreads quickly when people gather, especially if they're indoors. Fall activities and gatherings have increased opportunities for the virus to spread. I understand. We all wish it was different. So many of our personal and cultural traditions are being tested as we continue to learn how to coexist with COVID. We have no desire, and frankly no present need, to go back to the restrictions that were essential in the first few months of the pandemic. Most businesses are doing a good job of keeping their employees and their customers safe. The same is true for hospitals and healthcare. We have learned much about COVID-19 since the pandemic began. We have new treatments to care for severely ill patients, which means that many people are recovering and getting home faster. We know how to keep caregivers safe, and we are providing safe care to meet the health needs of everyone we serve. Amid all the progress we have made, sadly, we also continue to see the spread of misinformation online and in the community. Much of it seems designed to discourage people from taking the simple steps that we know will help us to be safe. For example, some people have claimed that the danger of the virus is overblown and that hospitals are inflating the number of COVID-positive patients. That's simply not true. From March through October, more than 700 people in Delaware died from COVID-19. In Maryland, more than 3,900. In Pennsylvania, more than 8,700. And in New Jersey, more than 14,000. Hundreds of thousands more across these 4 states and more than 8 million people in the United States have contracted the disease and recovered. But we still don't fully understand the potential long-term impact it will have on their health. This virus continues to be a significant danger to people of all ages. Our healthcare workers continue to deliver outstanding care and save lives while dealing with the stress and grief that this pandemic causes. And when a vaccine comes, it will not instantly put us in the safe zone. It will take time. What we do today will affect many people, and we have a choice. Our actions will either save lives or put more lives in jeopardy. The right choice is clear. Please wear a mask, physically distance, avoid gatherings big and small, wash your hands, and use hand sanitizer frequently. If you have even the mildest of symptoms, please isolate and get tested. And get your flu shot now. We must make this choice for our children so they can go back to school, and for our grandparents so they are no longer isolated. We must do it for those among us who are more vulnerable because of age, frailty, a compromised immune system, or a pre-existing condition. We must do it for our Black and brown communities who continue to be disproportionately affected by the virus itself and by the economic impact of the pandemic. We must do it for our restaurants, gyms, salons, retail stores, and churches that are beginning to rebound. And we must do it for our essential workers, our healthcare workers and first responders, and all those who work in grocery stores, pharmacies, the food industry, and other services that we depend on. They have provided for us since the beginning of the pandemic, and we must do our part to keep them safe. With patience and fortitude, with grit and grace, we can do this. Let's be safe and protect each other.